Lyme disease can affect the brain. How would be the symptoms of the brain? It would be a little bit different sometimes from one you would normally see from just a little bite in the arm and arthritis?
If somebody has a central nervous system Lyme and they have it for a very long period of time, the inflammation in the brain can affect different areas of the brain. It could affect the area of the brain that affects stomach emptying. They may present with delayed gastric emptying, nauseousness, vomiting, weight loss.
And if you were concerned about that, would they have other symptoms of Lyme disease, like classical Lyme, with arthritis and stuff?
They may or may not have arthritis. They could have just central nervous system Lyme, poor concentration, decrease in grades, brain fog. They could have other Lyme symptoms such as...
Do they have a history that you could elicit of a tick bite?
They might have a history of a tick bite. They might have a history of an EM rash, but they would usually have delayed diagnosis and delayed treatment of over a year.
If you suspect it, how would you treat that?
If I suspected it, I would initially treat it with doxycycline if they're over 7 years of age, 100 milligrams twice a day. If they're under 7 years of age, I would treat them with amoxicillin. Amoxicillin has very good penetration into the central nervous system. The only problem with amoxicillin is it doesn't cover other co-infections that may come along with Lyme.
What are some examples?
In this particular area, central New Jersey, Bartonella is more prevalent than Lyme disease. Bartonella can also be present in the brain. Amoxicillin alone would not treat for Bartonella.
And if you had a kid under, say, 7, would you use anything besides amoxicillin?
A kid under 7 with central nervous system Lyme and or Bartonella, you could use Zithromax. You could also use Bactrim.